All right, one of the things to comment on is what about pain after surgery? Well, as we talked about, there's expected to be some pain because it's major surgery. And we give thanks that in general, the pain that our patients feel is pretty minor, pretty mild. Occasionally, though, you might have an hour or a period where there's more pain, and we heard about that in clinic on Tuesday where we had a patient from the previous week who had kind of a bad night, where in fact his pain was severe enough that he was frightened and worried about it and called me the next morning. And so you might wonder, gee whiz, Dr. Rutledge, I have had hip surgery or foot surgery, and after surgery I got codeine, or Tylenol with codeine, or Percocet, or Lortab, something narcotic plus something, Vicodin, drugs like that. And I notice you don't give those, and I would like to know why. Because your patients can and do have some pain post-op. Well, it goes back to the fairly radical approach, which is discharging you within hours of your first surgery. That's a very radical approach, with the majority of other doctors around the world keeping people in the hospital after gastric bypass for 1, 2, 3, 4, 5, 6, or even 7 days. So it's very radical to send somebody home at 1 day, and what we found is we can do that safely as long as we don't cover up any painful symptoms. So as you may remember, the gentleman who was complaining of the pain said he called me, said he had terrible pain, and I said go to the ER. And that's kind of our process. If you can go to the hotel or home this afternoon, 24 hours after surgery, and are not in terrible pain, we have found that safe. If you do get terrible pain, uncomfortable pain, we want you to come back. So that's not good enough to earn your iPod, because that's... If you do get bad pain, then we want you to come back. Okay? And then we would assess you to see if it's just some pain or whether it could be a tragedy, something dangerous like a leak or an infection. What we don't want to do is let you go home early, which is radical, cover up the potential pain with a narcotic like Lortab or Vicodin, and not discover that you actually had the equivalent of a ruptured appendix until 4 or 5 days later. And so let me go back to that and do the example. If you have appendicitis, it's awful. You have pain, you go to the ER, they take out your appendix, you usually go home the next day, and that's that. It's not a fun weekend, but it's also not the end of the world. I had my appendix out, something like that. On the other hand, what could be tragic is you have appendicitis and you find your wife's prescription for Percocet that she got for her kidney stones. And you take those, and you take those, and you find if you take enough Percocets, you don't care if you have appendicitis. Until 3 or 4 days later, and then all of a sudden things are much worse, and you've converted an overnight irritation, unpleasant day into a life and death situation. So what we'd like to tell you is, if you need narcotics, we'd love for you to stay here, and we'll give you all the narcotics you need and want while we can monitor you closely. If you want to take the fairly radical approach, which we encourage, of going home right after the surgery, going home to the hotel right after surgery, that can be done safely only as long as you're relatively comfortable. And if that changes, then everything else has to change as well. We want to be vigilant this week. We're not frightened, we're not worried, but we are vigilant. Just like if we're driving fast on an interstate, we don't close our eyes. So we found we can do a hospital discharge within 24 hours after the surgery safely, as long as we don't cover up things with narcotics. So we do give you some pain medicine, but they're really kind of a trick. We give you little baby doses of Tylenol, little baby doses of Benadryl, things like that, that wouldn't cover up something severe. And so hopefully when I keep you from getting narcotics post-op, it's not because I'm mean, but because of my concerns about your health and safety.
When do we resume our current medications?
You don't do anything with any medicines without talking to me. So if you get the drive to take some medicine, call me first.
No drive. I got diabetes medicine.
Yeah. So for your diabetes, let's talk about that now.
And Zocor.
Yeah. The Zocor is simple.